just want to ask a follow-up question on sedation, because I know, like you said, it's a big common practice for you. And it sounds like there's some patients that come in maybe and they're just anti, sedation, whatever. But what are one or two reasons that people come in that are misconceptions about why they're nervous specifically about sedation?
A lot of patients think they're going to lose control. They don't want to lose control. They're afraid they're going to maybe say things that they shouldn't say, and they're worried about, and some of them are worried about not coming out of it. What? They're scared. I mean, you're putting me to sleep. Am I going to come out?
They think it might be dangerous. They turn it into, they hear about people who have general anesthesia who actually have a big problem. But this is night and day difference. They never lose their ability to breathe or their airway or anything. So it's night and day. It's just different. It's not general anesthesia. So their fears of that and are not warranted, Yeah,
these patients are breathing on their own. They can actually take instruction. If we ask them to open wider, they can usually open wider. And they can, we don't put them so far under that they can't respond. And they can always breathe on their own. We don't have to worry about breathing for them or intubating them. It's just very, very safe. And in fact, I think it's safer than not using anything because their blood pressure tends to go down. They have less anxiety. They're more comfortable. And it just makes the whole experience so much easier.
That's a great point. It's actually safer than not using it.
And safer.
And another magical benefit is that we're talking to them and telling them to do this sometimes, and they're responding. When they go home, they can't remember anything, It's sort of like me. I can't remember anything. But I'm not even on Versed.
I'll tell you, for me, that was worth the price of admission here. I think that's such a key misconception for people of not fully understanding the type of sedation that you guys do. And they hear these scary things from the hospital, and to hear that they're night and day different, to me, makes all the difference in the world. So thanks to you both for clearing that up.
And by the way, I just want to mention one thing briefly, and that is we have what's called reversal agents. So if a patient is a little bit more asleep than we want them to be, we give them a reversal agent, and then they're less asleep. So we can control how comfortable, how relaxed, how asleep, or how not asleep the patient is and the patient wants to be. So we monitor it. We're monitoring their oxygen. We're monitoring their breathing. We monitor their blood pressure. We monitor them very, very closely. And we make sure that they're always safe. And the drugs we use have a wide, wide margin of safety. Very wide. It's not, as like Tom said, it's not general anesthesia where we're putting the patient under. These patients are just sedated, and sedated to the point where they're comfortable and we're comfortable with it.